Have you ever wondered if highly sensitive people are more susceptible to certain diseases? The answer might surprise you. As an HSP, you have a unique ability to notice subtleties and nuances in the world around you, but this often comes with a price. The constant exposure to overstimulation can take a toll on your mental and physical health. Let's delve deeper into the 5 common conditions that often occur in HSPs and how you can prevent them. Let's take a closer look at the first condition that is often prevalent in HSPs. Number 1. Burnout. It's surprising to discover that as many as 50% of HSPs experience burnout, making them a significant at-risk group. This condition is characterized by a profound sense of exhaustion and burnout, accompanied by common psychological symptoms such as memory and concentration problems, as well as a short fuse. It's interesting to listen to how people with burnout reflect on their experiences. Many of them acknowledge ignoring the early warning signs such as tension symptoms and fatigue, because they were afraid to say no, afraid to ask for help, and felt responsible for everything. This underscores the importance of recognizing the early warning signs and actively addressing them. As a highly sensitive person, you are more sensitive to stress and overstimulation than others. When you constantly push your boundaries and don't give yourself enough rest and recovery time, you risk experiencing burnout. This is not just ordinary fatigue that disappears after a good night's sleep. It's a profound sense of exhaustion, both physically and mentally. Symptoms of burnout can build up slowly, often starting with subtle signals like decreased concentration, irritability, and fatigue. It's important to understand that burnout doesn't go away on its own and requires time and dedication to recover. To prevent burnout, it's essential to get to know yourself well and respect your boundaries. Learn to say no when necessary. Take regular breaks and seek support from friends, family, or a professional if you find that stress is becoming too much. Putting yourself first and taking good care of yourself allows you to lead a healthy and balanced life as a highly sensitive person. Let's move on to the second condition. Number 2. Chronic fatigue syndrome. This condition is characterized by persistent fatigue that lasts longer than 6 months, even after adequate rest and sleep. This fatigue can severely limit your daily activities, whether it's work, study, sports, or social interactions. In addition to fatigue, people with CFS may also experience other symptoms such as muscle pain, headaches, memory and concentration problems, and even mood swings. These symptoms can lead to feelings of discouragement and frustration, as they hinder you from leading a normal life. It's important to understand that CFS is a complex condition that is not fully understood. While the exact cause is unknown, there are several factors that contribute to its development, including genetics, environmental influences, and psychosocial stressors. To prevent CFS, it's essential to maintain a healthy lifestyle. This includes regular exercise, adequate sleep, stress management techniques, and a balanced diet. Additionally, it's important not to overexert yourself and take good care of yourself, both physically and mentally. By being proactive in managing your energy levels and listening to your body's signals, you can reduce the risk of CFS and lead a healthier, more balanced life as a highly sensitive person. Let's now look at the third condition. Number 3. Fibromyalgia. Fibromyalgia is a common condition, often associated with highly sensitive people. It is characterized by chronic pain, primarily in the muscles and connective tissues. This pain is often accompanied by stiffness, fatigue, sleep disturbances, and mood swings. Symptoms of fibromyalgia can vary in intensity, sometimes worsening and sometimes improving. It's also important to know that fibromyalgia is classified as a rheumatic condition. It affects about 2 out of every 100 adults, especially women. For people with fibromyalgia, even the simplest daily activities can be challenging due to constant pain and fatigue. This can lead to feelings of frustration, helplessness, and isolation. While the exact cause of fibromyalgia is not fully understood, There are several factors that contribute to its development, including genetics, environmental factors, and psychological and social stressors. It's important for people with fibromyalgia to have a comprehensive treatment plan aimed at managing symptoms and improving quality of life. This may include the use of medication, physical therapy, cognitive behavioral therapy, and alternative therapies. Additionally, maintaining a healthy lifestyle with attention to adequate rest, regular exercise, stress management techniques, and a balanced diet is essential. Let's move on to the fourth condition. Number 4. Irritable bowel syndrome. IBS is also a common condition that often occurs in highly sensitive people. It is characterized by various symptoms including abdominal pain, cramping, chronic constipation, diarrhea, or alternating between diarrhea and constipation. Additionally, gas formation in the intestines and bloating after meals can also occur. These symptoms can cause not only physical discomfort but also emotional stress and anxiety, as they are often unpredictable and can affect the daily lives of people with IBS. While the exact cause of IBS is not fully understood, several factors contribute to its development, including genetics, diet, psychological factors, and dysfunction of the intestines. To manage IBS, it's important to maintain a healthy lifestyle and identify triggers that may worsen symptoms. This may include avoiding certain foods, reducing stress and anxiety, consuming a high-fiber diet, and staying adequately hydrated. It's also helpful to work with a healthcare provider to create a personalized treatment plan tailored to your needs and symptoms. Let's now look at the final condition. Number 5. Hereditary spastic paraplegia, or HSP. HSP is a hereditary disorder of the spinal cord that causes slowly progressive stiffness and spasticity in both legs. In people with HSP, the legs become increasingly stiff due to a genetic abnormality. This condition has different types, each with its own characteristics and prognosis. In the pure form of HSP, there is primarily slow progressive stiffness, also known as spasticity, and weakness in both legs, often accompanied by an abnormal gait, painful cramps, and decreased sensation. In addition to these symptoms, sensory disturbances, pain, depression, fatigue, sleep disturbances, balance problems, and bladder and bowel problems may also occur. In the complicated form of HSP, coordination disorders, cognitive disorders such as memory and learning problems, attention disorders, articulation problems, epilepsy, visual problems, hearing loss, skin problems, and a possible muscle thinning in the hands and feet may also occur. Treatment for HSP usually focuses on managing symptoms and slowing the progression of the condition. Some treatment options include physical therapy, mobility aids. This include orthopedic shoes, braces, walking sticks, or rollators, medication to reduce spasticity and muscle cramps. If you, as an HSP, constantly push your boundaries, you risk becoming chronically overstimulated. Your body enters a constant state of stress, with hormones like adrenaline and cortisol accumulating, making it difficult to relax. This can ultimately lead to illness and other health problems. As a highly sensitive person, you often tend to prioritize others and ignore your own needs. It can be challenging to recognize and assert your own boundaries, especially if you tend to prioritize the needs of others over your own. However, recognizing and respecting your own boundaries is essential for maintaining your well-being and health. So, don't be afraid to stand up for yourself and clearly communicate your boundaries. It's not selfishness, but rather an act of self-care and self-respect. By taking good care of yourself, you can better cope with the challenges that life brings and lead a healthier, more balanced life.